Clap along if you feel like a room without a roof. Clap along.
Welcome to our podcast today, where we have a special guest, Bob Boyer, who is the practice leader for a company called Day 2. And we're going to talk a little bit about what Day 2 does and precision nutrition and how that's very similar to precision medicine that we've talked about for a long time. So as consultants, one of the things that we're always tasked with is coming up with new solutions to problems that employers are experiencing. And today, in February, we're at the beginning of the year. February is right around the corner. And one of the things that we're thinking about right now is how to tackle the high cost drivers in our program. So we talked a little bit about Q1 and how important it is to get your calendar year end utilization data from last year to see and cull through what are the top cost drivers. And we're in the process of doing that. And then we set up a strategy meeting. So once we identify what the problems are, we look for solutions or ways to tackle those issues from not only a cost perspective, but how do we help the members be healthier and more productive. So diabetes is always at the top. So it's either, 1, 2, or 3 as a top driver of costs. Diabetics have a ton of comorbidities. Unfortunately, it's a disease that affects the entire body. So they have podiatric issues, eye issues. So diabetics cost 2.3 times more than your average employee for healthcare. So the healthcare costs for a diabetic are 2.5, almost 2.5 times what a normal member would cost. 34 million Americans suffer from diabetes, and a startling 84 million Americans are pre-diabetic. So it's something that we're seeing on the rise. And in the United States, we spend over 330 billion with a B on diabetes. So I'm going to introduce Bob. And Bob, as the practice leader for Day 2, why don't you tell us a little bit about what Day 2 does and really explain to us what precision nutrition is?
Yeah, thanks, MB. Really appreciate it. You do a great job with these, and it's always a pleasure to catch up. So thank you for having me. So Bob Boyer, been with Day 2 for a couple of years now, leading the growth practice, spent 20 plus years in the industry, healthcare industry. And you hit it right on the head with employers. If diabetes or, metabolic disease isn't one of the top 3 conditions, it's definitely trending in that direction. Most employers we work with, it falls into the top 3 category. And the innovative thing about Day 2 is that we are, like you said, a precision nutrition, food is medicine approach to treating folks with type 2 diabetes, prediabetes, obesity, and even more broadly, fatty liver and NASH, other metabolic conditions. And we do it through the use of a gut microbiome profile. And so I'm sure we've all seen the commercials for Cologuard. It's a very similar process. It's a home test. And gut microbiome profile is probably a fancy way of saying a stool sample. And so we have a home kit that we send. And the power of Day 2 and the gut microbiome is that we have the ability to look at each individual's. We have labs in Alabama and Israel that allows us to do what's called a shotgun metagenomic analysis. We have the ability to really go deep into the diversity and abundance of bacteria in each individual's gut. And so we've built a patented algorithm that when we plug in the gut microbiome profile and we gather some additional information about each individual, age, sex, et cetera, we can accurately and precisely predict how an individual's blood sugar will react to food and food combinations before they eat. And that's really the kind of the aha moment for our members and patients, is that they can accurately see before they eat how food is going to impact their blood sugar level. And it's really important, and you hit it on the head when you talked about the comorbid conditions, because one of our big measurements is keeping people in range, time in range, because as people spike in and out of range, that's when ultimately you can see the inflammation and kind of the end organ damage and some of the other comorbid conditions that you talked about.
Wow, that's really crazy. So once an employer decides to engage Day Two as one of their, partners, how do you work with employers on, I guess, identifying the population of diabetics, and what's the process of
Yeah.
actually getting started with an employer for this? If an employer had a big population of diabetics, one thing that I will say to you is there's tons of diabetic management, disease management programs out there. But the problem that we have and that we see is that we identify the diabetics and then we can't get them engaged. We can't get them enrolled. We have, a 5% engagement rate, which is too low, quite frankly.
Right. Yeah. And so if you look at this area, whether it's on the carrier side or other vendors that play in this space, it really is like you said, an identification, and then it's like a manage and control type of approach, which doesn't always lead to great adherence. And we see engagement numbers drop. And so what we would do is we would identify the population most likely through claims, medical and pharmacy claims, and we would build a communication campaign alongside of you and your clients. We've got plenty of content. We've got a library of materials. We're pros at doing this. We definitely don't want it to feel like it's Big Brother. We're not pulling out data and just specifically targeting a campaign at those folks. But we build a creative campaign around, this is a great new benefit. You're eligible. We are an opt-in program. We're not an opt-out. So we have to do the legwork and identify and do the outreach. And once people are on board, they go through the enrollments, and that's when they get the home kit. And we see tremendous engagement because not only do people get empowered to make their own decisions, they could be sitting in line at the Chick-fil-A and type in what they think they're going to order and see how their body is going to react before they eat it. We're also not a low carb, no carb, very restrictive general diet approach. It's very precise. It's based off of your individual gut microbiome profile. And so that really leads to great engagement. And when you wrap in some digital tools like our app and the one-on-one coaching that you get with your own personal dietitian, we see great engagement over the long haul because it is such a different type of a program. We are not just monitoring and managing. We have a remote monitoring component, but we're really giving people the opportunity to modify without going into a completely restrictive diet approach. And it's really based on their own body. So
That's great. And I'm thinking, as you were talking, you could even, as an employer, wrap a value-based plan design around this, where if you identify the diabetics, sending information out to them and encouraging them to participate in the way of, if you participate in this particular program, we'll cover some of your medications for free, or in a high deductible plan, maybe giving them a contribution to the HSA for participation. So there's lots of ways that I think we could really get our arms around this diabetic population that's driving cost and potentially could be some of the next high claimants, right? So if we can, one of the things that you said to me when we first started talking is, understanding the gut health and helping diabetics change the course of their disease so that it enables them to become, on the path to remission, which is something that I've never heard with diabetes. For decades, we've been talking about diabetes and talking about how to manage diabetes, but never really how to influence the course of treatment and the course of the disease into an actual remission. So very exciting. I think it's a very exciting time in medicine. I know that I've been saying for the last year that we're going to see more change in the next 5 years in medicine than we have in the last 50. And it's exciting to meet companies like yours who are looking at things differently and looking at, gut health and genomic makeup and how that can influence preventing and treating diseases versus, the way that we've been going at it with just medications. So when you look at the population that you've engaged with, so I'm sure you have companies that you've rolled out this program, what what are the benefits that employers are seeing from this?
Yeah, and great comments on gut microbiome. Anybody who Googles gut microbiome will see a ton of research out there, and I think that's the science behind day two is really the powerful piece. And with the employers that we roll it out to, not only do you see really good engagement because they have that interaction with their own registered dietitian, certified diabetes counselor, they get the ability to really understand their body differently, and they can make decisions or modifications alongside of their dietitian in collaboration. And they can do that research on meal planning before they actually eat, because if you think about food with folks that are struggling with their blood sugar or other comorbid conditions, it's really a big stressor for them. And to be able to pull that off their plate is pretty powerful. We see, on average, point and a half, we've got clinical metrics and then financial metrics. But on the clinical side, we see point and a half reduction in A1C levels. We're seeing double digit weight loss. We see increases in time and range. And then on some of the softer, more self-reported measures, we see increases in energy. People are sleeping better. Their hunger is dissipating. And they're also reducing stress. And that's an important, in the general wellness category, reducing stress is such a big deal. And food is really personal, and it's cultural, it's holidays, it's the family. And so to be able to help them is great. Working for a mission driven type of a company that's really trying to enable that path to remission, as you mentioned, is pretty powerful. And on the financial side, as soon as you start peeling people off of reducing their medications, whether they're dosages, or you pull them off of the injectables, the Ozempics and the Trulicities, and some of the high cost orals like Jardiance, and then even some of the insulins. I mean, those could be anywhere, cost a health plan $15,000 to $20,000 annually each. And so we see some immediate impact, even in the pilots that we do, which are basically about a 6-month window. We see people getting off their medications, losing weight, really tremendous stories. And ultimately, that's going to impact the employer when it comes to costs. And longer term, we see decreases in emergency department usage and other facilities and outpatient type charges. So
Phenomenal. Well, I look forward to working with you on a couple of cases so that I can learn more about the process. I think it's exciting. Anything that will help us reduce cost and improve the health of our members is something that is top of mind and at the forefront of all of our strategies. So thanks so much for joining me today, Bob, and look forward to continuing to learn more about your product.
thanks, MB. I appreciate it.
All right. Take care, Bob. Thanks.
Bye-bye.